One of the commonest challenges that we have is to see the time scale of AMH decline in fertility progression women with a low ovarian reserve. And let's look at the key longitudinal studies. The Doticham cohort study, which is a 20-year population based evidence, and it followed 3,326 women over 20 years with 5 visits, provided the most comprehensive longitudinal data on AMH decline patterns, and this study revealed that the AMH decline rates are not uniform across women, and that the overall rate of AMH decline accelerates after the age of 40. The study found an interclass correlation coefficient of 0.87 and indicated that women with low age-specific AMH tend to maintain consistently low throughout the reproductive lifespan. And that's something important. And it's often well known that women hold on to a low AMH for a long time. So let's look at the SWAN study. And the SWAN study was predicting menopause timing. And a study women health across the nation tracked 1,537 pre or perimenopausal women, demonstrated AMH becomes a superior predictor of menopause timing compared to FSH, particularly for 24 to 36-month prediction. Women with AMH less than 10 picogram per ml had a 51 to 79% probability of reaching menopause within 12 months, depending on age. This, and again, remember, this is in the perimenopausal age group. Showed that AMH levels progressively decrease as women approach their final menstrual period, with 14% of samples having undetectable AMH 12 to 24 hours before menopause, rising to 25% within 12 months of menopause. When you look at the Penn ovarian aging study, long-term prediction, the 14-year Penn ovarian study of 401 women demonstrated AMH strongly predicts time to menopause in a dose-dependent manner, with baseline AMH levels below 0.2 nanogram per ml had a median time to menopause approximately 6 years in the 45 to 48 years age and nearly 10 years in the 35 to 39 group. In contrast, women with AMH above 1.5 nanogram per ml had a median times exceeding 13 years in the same. So if you look at the time progression from low AMH to clinical, the early phase from low AMH to clinical manifest, early phase is maintenance of regular cycles. So what happens? Cycles are constantly regular, 2 to 8 years, and multiple studies confirm that women with low AMH can maintain regular menstrual cycles for extended periods without obvious fertility impairment. The Tehran lipid and glucose study found that the women with consistently low age-specific AMH could maintain regular cycles for several years, and that is very important. So you don't look at AMH and say your cycles will get irregular. Some women hold on to that low AMH with regular cycles for a very long time. Intermediate phase, subtle hormonal changes, 1 to 5 years before irregularity. Studies show that FSH elevation occurs when AMH levels falls below a critical threshold. Research from a large data set of 21,000 women aged 18 to 40 revealed that FSH remains relatively stable until AMH drops below 0.5 nanogram per ml, after which FSH increases suddenly. The relationship between FSH and AMH follows a threshold rather than a linear decline. The late phase when menstrual irregularities occur and fertility decline, and here population studies have also found that cycle changes occur typically 1 to 3 years before complete ovarian failure. Women with low AMH, shorter menstrual cycles, and shorter follicular phase happens as AMH declines. This progress of irregular cycles accelerates when the AMH approaches undetectable levels within 2 to 5 years of initially low AMH levels. And what is the time scale from low AMH to FSH elevation? 2 to 5 years. Low AMH to menstrual irregularities? 3 to 7 years. And low AMH to fertility decline? 5 to 10 years. What do we see? We see an individual variability. So all women don't follow this regime. Women diagnosed with low AMH before 35 hold on to it much longer. Degrees of AMH reduction: women with extremely low AMH progress more rapidly, and genetic and environmental factors. What are the limitations? It is heterogeneity, definition variability, follow up, large population based. So if you look at the studies now, if you go into detail, the Dotticham study was a 20-year-old study focused on AMH decline rates and ovarian reserve. The Swan study tracked 1,537 women in the perimenopause, and the Penn ovarian reserve study demonstrated AMH strongly predicts the time to menopause in dose-dependent manner. So that's how we look at the early phase, 2 to 8 years, the late phase, intermediate phase, when AMH drops for 1 to 5 years, and within 2 to 5 years when the cycles become more irregular. Once again, 2 to 5 years is the first after you notice low AMH. Irregular occur 3 to 7 years, and 5 to 10 years to see a fertility decline. What are the factors which affect the individual variability? The age of diagnosis. Women diagnosed with a low AMH before the age of 35 often experience a longer interval before seeing developing menstrual irregularities. If you look at the degree of AMH reductions, individuals with extremely low AMH tend to progress more rapidly, and genetic and environmental factors contribute quite significantly. Earlier, there is assay heterogeneity, there is a definition variability, and follow-up is quite varied. So it's very difficult to be able to pinpoint the exact. Why is it important? It's important because one is it allows us to have a personalized counseling. It allows us to discuss about AMH levels. If AMH levels are extremely low, it tells us to find a link between irregular periods. If there's an irregular period that starts occurring with low AMH, it does indicate that that decline in fertility is significantly more. But I think it's important to be able to give a general idea, looking at the FSH, the AMH, the antral follicle count, and how the cycles are undergoing. An irregular cycle with a very low AMH is one of the first signs that the ovary is giving up. Studies which looked at the ovarian aging, including AMH, there's a huge amount of work done. We're still not very clear of how fast the AMH drops, how fast does the aging process carry on, and that is something which is only time will tell us.